Hello everyone. Today we are going to talk about spinal disease. Spine disorder, ST, and associated pain are major medical, social, and economic problems because of their higher prevalence. Your backbone or spine is made up of 26 bone discs called vertebrae. The vertebrae protect your spinal cord and allow you to stand and bend. A number of problems can change the structure of the spine or damage the vertebrae and surrounding tissue. Spinal diseases often cause pain when bone changes, but pressure on the spinal cord or nerves, they can also limit movement. In this video, we will explain to you about the types of diseases that may affect the spine, their symptoms, and how they can be diagnosed and treated. So our role today is to answer most of your questions regarding spinal disease. Today we have Dr. Kim, who is a leading doctor at MEDREX Hospital. He's going to discuss with us everything about spinal disease from an experienced medical point of view. Hi, I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Hello, Dr. Kim. Can you please introduce yourself to us?
Hello, my name is Kim Woo-ka, a neurosurgeon who works at MEDREX Hospital. I'm in charge of spinal diseases.
Okay. Straight to the first question. What is the most common spinal disease in your patients?
The most representative spinal diseases are stenosis and slip disc. The spine consists of cervical spine, thoracic spine, and lumbar spine, and stenosis in each area is the most common disease, followed by slip disc. Rarely there are diseases such as ossification of posterior longitudinal ligament or yellow ligament osteoporosis, a post-species in which ligaments extending up and down from the spine turn hard. And more rarely, cancer can occur.
Okay. So what's the difference between spinal stenosis and a herniated disc?
The most common diseases, stenosis and slip disc, look similar but different. First of all, stenosis can be easily expressed as such a round tube of the spine. When this tube narrows, all of it is called spinal stenosis. Slip disc is limited to cases where some of the intravertebral discs that make up our body burst and press the nerves. Therefore, in general, symptoms appear in both legs when it comes to stenosis. And in the case of slip disc, symptoms appear in only one arm or leg.
So what are the usual causes?
Spinal disease basically causes degenerative changes as our body ages, which slightly worsens the spine. Along with these natural changes, bad lifestyle habits influence. Bad lifestyle habits include sitting bend or sticking your neck forward, and the habit of lifting objects using only your upper body when lifting heavy objects, and lifting heavy barbells that do not fit your body too excessively. And smoking also have a bad effect on your spine.
So what are the symptoms for each of the spinal stenosis and the herniated disc?
Stenosis occurs a lot in the waist and can also occur in the neck. Let me tell you about the most common back stenosis. The most common symptoms: pain from the waist to the hips and the legs when walking. Because of this pain, the most common symptom of the spinal stenosis is that the more you walk, the more you feel sick and unable to walk anymore. Listening to these patients, they said, "I sit down and rest for a while because I have a backache while walking. Then the symptoms get better and walk again. But soon I get sick again and rest again." Repeating walking and resting like this is a symptom of spinal stenosis. Slip disc also occurs more in the waist than in the cervical spine, and the most common symptoms are pain and numbness from one hip to the leg, and in severe cases, poor leg strength.
So what kind of tests are done in this case?
X-rays are most basically taken for all spinal diseases. The reason for taking an X-ray is to see the arrangement of the spine. Rarely the bones themselves have problems and appear on X-rays. However, since X-rays can only obtain the most basic information, MRI, the most precise test, is performed. MRI allows you to learn in great detail about the disc between the vertebrae and the bones and the nerves in it. Therefore, MRI is the most important test because you can know all of these things in the most detail, such as a broken bone, a disc burst, or a narrow path through which the nerves pass.
Okay. Can you tell us more about what's an injection therapy and non-surgical treatment for this kind of case?
In addition to natural degenerative changes, damage caused by other factors is added to the spine, resulting in illness. One of the treatments our hospital provides is a treatment called new spot cell. This treatment is for the posterior bone joint, an important part of the spine. There are ligaments surrounding the bone joint, respectively. Therefore, if there is a problem with this joint, and the disc for degenerative changes or various reasons, the ligaments surrounding this joint are treated as part of the regenerative therapy. It can be said that the inflammation of each ligament is cured and the tissue is regenerated through the new spot cell treatment. It is a treatment that improves the overall stability of the spine because stronger ligaments are formed after this regeneration than before, and these ligaments wrap the joint stronger. Among the non-surgical treatments, there's endoscopic treatment. Endoscopic treatment is a fundamental treatment. It is a treatment for stenosis or slip disc. Previously, most of them had big wounds and had surgery by opening them wide. As a result, the large wound caused pain. And elderly patients or patients suffering from various chronic diseases had difficulty undergoing this operation. However, endoscopic treatment is a method of treating with a very small wound and an endoscope through this wound. Therefore, there is no need for general anesthesia. Therefore, elderly patients or patients who are unable to receive general anesthesia due to various chronic diseases can receive treatment through endoscopic treatment. The endoscope can enter a small wound and insert the endoscope tool directly into the wound to see very closely and treat it. It is a more accurate and precise way to treat the disease.
So my last question, is there any ways to prevent this disease?
Spinal diseases caused by natural degenerative changes cannot be prevented. As you get older, you can't change your spine with age, but the way to make up for them and slow them down is to always maintain a good posture. For example, it's not a bent position, but a good posture to sit with your back straight. This posture allows you to maintain a good posture not only for your back, but also for your back and neck. It is important to make this habit a part of your life. And there are muscles that wrap around the spine, and it is a good exercise to steadily strengthen these muscles. It's not easy to exercise steadily, but rather than having spinal problems, when I'm older, I think it's better to exercise steadily to reduce the possibility of such a disease. In addition, when lifting an object, people usually use only the upper body when bent to lift the object. This habit is very bad for the spine. Therefore, it is recommended to bend your knees. Put things close to your body and lift them using your pelvis and knees. Making this habit a part of your life is a good start to prevent spinal diseases.
Okay, great. Thank you, Dr. Kim, for today.
Thank you.
Thank you so much. So today we learned many things about spinal diseases, and the doctor explained in details everything related to spinal diseases, such as symptoms, diagnosis, and possible complications. Thank you for joining us once again today at CloudHospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.